So today our topic is improving patient safety in hospitals. Patient safety is one of the most important parts of healthcare because hospitals are supposed to help patients recover, not expose them to preventable harm. Our infographic focuses on what patient safety means, the major problems hospitals face, the impacts of poor safety, and possible solutions. So what is patient safety? Patient safety means protecting patients from preventable harm while they are receiving healthcare. This includes preventing medical errors, reducing harm to patients, and improving quality of care. For example, patient safety includes things like giving the correct medication, preventing infection, avoiding surgical mistakes, and making sure providers communicate clearly with each other. Now, as for key issues and problems, there are several common problems that affect patient safety in hospitals. One major issue is poor communication. If nurses, doctors, and other staff do not communicate clearly, important information can be missed. For example, a patient's allergy medication or abnormal lab results. Another another problem is the lack of training. If staff are not properly trained on safety procedures, technology, or emergency protocols, then they can risk error um, or have uh, increase in risk. Staffing storage shortages is one problem as well. When there's not enough nurses or doctors, staff can become overworked, and that can lead to more errors or have a higher risk of errors, which lead to not the best quality of care for patients. And then another is system error, meaning the problem is not always one person's fault. It's the entire structure of the organization. So it could be sometimes the hospital's process, technology, workflow, or even the policy. Finally, time pressure. It can lead to a lot of mistakes because hospitals can be busy, workers may have to make quick decisions, and this can increase the chance of a misstep or error.
When it comes to impact, poor patient safety can be very serious. Medical errors can cause patient harm, longer hospital stays, complication, or even death. This is why patient safety is considered a major public health issue. Poor safety also increases healthcare costs, and when mistakes happen, hospitals may need to provide additional treatment, repeat tests, and extend the patient's stay, or deal with legal and administrative consequences. Another major impact is loss of patient trust. Patients expect hospitals to be safe. When safety problems happen, patients and families may lose confidence in the healthcare system. So, poor patient safety affects not only the patient's health, but also hospital costs, staff performance, and public trust. When it comes to solutions, hospitals need to focus on both people and systems to improve patient safety. First, hospitals should improve communication between teams. This can include better handoff procedures, clear documentation, and team meetings so everyone understands a patient's condition and care plan. Second, hospitals should increase staff training. Training helps employees stay updated on safety practices, new technology, infection control, and emergency procedures. Third, hospitals should use technology effectively, especially electronic health records or EHRs. EHRs can reduce errors by making patient information easier to access, improve documentation, and using alerts for allergies or medication interactions. Another solution is to encourage reporting of errors. Staff should feel safe reporting mistakes or near misses without fear of punishment. This helps hospitals learn from problems before they happen again. Finally, hospitals should promote teamwork. Patient safety depends on doctors, nurses, administrators, pharmacists, and other staff working together. In conclusion, patient safety is essential for improving healthcare outcomes. Hospitals need strong systems, clear communication, proper training, and teamwork to reduce preventable harm. And these are the sources we use for our research.